There are a lot of definitions of what is normal menstrual flow, and there are equally as many definitions of what is abnormal menstrual flow. My easy definition is if a woman thinks that her menstrual flow is not normal, then it is abnormal. Abnormal uterine bleeding usually falls into 4 broad categories. Typically, the bleeding is either hormonally related, infection, cancer, or some kind of organic problem with the uterus, whether it is fibroids, polyps, abnormal tissue collection. And it's very important to be methodical and delineate all these issues and find out exactly what is the problem, because the treatments for each one of those is vastly different.
Endometrial ablation is a technique that's designed to help control heavy bleeding. But for a woman who's done having children but doesn't wish to go the more surgical step of hysterectomy, ablation can often significantly decrease or sometimes even stop her menstrual flow. We also recently have begun partnering with a local anesthesia provider so that we can provide some intravenous sedation for those patients, which is not the same as being put to sleep in the hospital, but it does provide a patient who's concerned about being awake during her procedure that added comfort of being in a twilight sleep.
At the Group for Women, we have a lot of options available for treatment of abnormal uterine bleeding, from medical treatment all the way to the most advanced surgical treatment. Of course, each patient is individualized, and it's hard to make a broad statement of what is best for everybody, but rest assured that when you come to us and we take care of you, that we have all the options available.